Hello, I'm Terrence Zaffer Anderson, and this is Health Watch. Webster's Dictionary defines hope as the act of cherishing a desire with anticipation, to desire with expectation of obtainment, or to expect with confidence. But what if you were a pregnant college student facing daunting challenges? What if you were a college student who was also totally committed to being an active and engaged parent? Where would you find hope? And what if you were unemployed or underemployed and didn't have health insurance, but having need to be screened or treated for a medical condition? Where would you find hope then? Well, today's edition of Health Watch is all about hope. If you are in either of those situations that I just spoke on, we're going to tell you about a couple of programs that just might provide you with your own little measure of hope. We're going to do today's show in two segments. In the first, we'll learn about the Project Hope program at Norfolk State University. Then in our second segment, we're going to learn about the Eastern Virginia Medical School Hope's Clinic, conducted at the main Norfolk Public Health Center, located at 830 Southampton Avenue. You really should stay tuned with us for this entire show. It gives me great pleasure to introduce you now to Jennifer Dove, coordinator of Project Hope and the Norfolk State University Office of Pregnant and Parents and Student Support, based in the Ethelyn R. Strong School of Social Work. Welcome to Health Watch.
Thank you for having me, Terrence.
And that's such a cool name. I'm sorry, Ethelyn R. Strong. And
again, it is a fantastic name.
Yes,
it
indeed.
is.
And she was a fantastic lady.
Yes.
Tell us, please, what is Project Hope?
Well, Project Hope is a grant funded to the Ethelyn R. Strong School of Social Work at Norfolk State University, and it is funded through the Virginia Department of Health. The Virginia Department of Health received the funding from the Pregnancy Assistance Fund from the Office of Adolescent Health with the federal government.
And what is the purpose of the program?
Well, the purpose of the program is to provide assistance for students age 18 to 29 who are pregnant or parenting children under the age of 5. And what we do is we are a resource and referral program. So we help the students to get whatever resources they need so they can stay in school, because our overall goal is for them to stay in school and to eventually graduate.
You know, many years ago, I shared with you that I went to Norfolk State, yes. And when I went to Norfolk State, I was a young father.
Yes,
yes. And so I could have benefited from that program then.
And one of the unique things is we serve male and female students.
Yeah, I wasn't pregnant at the time.
Well, I'm sure you weren't. I'm sure you weren't.
Tell me, how does Project Hope fit into the overall mission of the university?
Well, part of Norfolk State University's mission is to transform lives and communities by empowering others to live up to their full potential. And I think that Project Hope fits right into that, because in order to transform lives and help our students to live up to their full potential, we want to help them overcome their challenges and their barriers. And that's one of the things that Project Hope does. You know, being 18 to 29 and being pregnant or having a small child is difficult. Mm-hmm. And so what we do is to connect them to the services they need so they can be empowered to finish school. Also, we are student focused. You know, the university is student focused. So the work that we do is specifically to help our students mm-hmm. to graduate, to increase Norfolk State's retention rate. And we all know that when students graduate from college, not only do they benefit, but their child is going to benefit, and our community will benefit as well.
What do you think contributes to the success of the program?
Well, like I mentioned before, one of the things that contributes to the success is that we're student focused. Mm-hmm. Not only do we serve students, but we have students who actually work on with our grant, on our program.
And Project Hope.
Yes, mm-hmm. we do. And what our students do is we have some bachelors of social work students who actually do case management. So they are not only learning what to do when they go out in the real world, but they're also helping our pregnant and parenting students. So they do their practicum with us. In addition, we have students who are peer educators. And what they do is they have proven that you can be a parent and you can be successful at school. And so they mentor our Project Hope students to help them be successful.
Any idea of what kind of numbers are students that are currently enrolled in the Project Hope program?
Right now, we just started 2 semesters ago, but right now...
Oh, it's a brand new program. I didn't realize
It is a fairly new program, but right now we have about 55 students that we are helping that are either currently pregnant or are parenting children age 5 or younger. So yes, we are moving along, and we're really doing some good work at Norfolk State.
You alluded to this earlier, but can you tell us a little bit more about the kind of services that Project Hope provides?
Well, we run the gamut of services that we provide. So like I said earlier, we are a resource and referral program. So we help students with internal resources, things on campus, such as getting textbooks, such as how to talk to your professor if you're pregnant and you have to walk out of class constantly because you have morning sickness. Or if you're due in the middle of the semester, we can help you figure out how you're going to talk to your professors about this, so maybe you can get your classwork and so you won't have to miss too much of school. We also do all kinds of things in the community. We help a lot of students get prenatal care. Some students come to us and they just found out they were pregnant and they don't know what the next step is. We connect them with classes. It could be birthing classes. It could be parenting classes. It could be any service that they need. It could be they need somewhere to live. So we provide them with resources and referrals to get whatever service they need to meet their challenges so they can stay in school.
I want to talk in just a moment about some of the success stories.
Okay.
But you just mentioned sometimes people come to you, young girls come to you having just found out that they are pregnant.
Yes.
What is the process? What happens if someone comes to you?
Well, what we do is for all of the students that we see, we do an initial intake where we just find out what the initial issue is, and we do an assessment with them. So usually if someone comes to us and tells us that they just found out that they were pregnant, then our number one goal is to connect them with a doctor, with an OBGYN. Some students don't know when they got pregnant, so it could be that they have been pregnant for 4 weeks, 6 weeks. It could be 8 weeks. It just depends. So our number one goal is to connect them with a physician. And we have people on our staff, we have a community liaison on our staff that has developed community resources. So it's not just a student comes in and we say, oh, well, you just need to go to the health department. We have connections with people in the community. So I can say to that student, you need to go see Sarah at the health department at 9 o'clock on Tuesday for your OBGYN appointment.
I see.
So we also provide follow-up services. So we just don't refer them or give them a resource. We meet with them several times, depending on what the need is, to make sure they are doing what they need to do.
I'm curious, have you ever encountered a situation, I know it's a brand new program, but have you ever encountered a situation where there is a single dad, not so much necessarily a single dad, but a male who's just found out that he's going to be a father, but he's not involved with the baby's mom? Have you encountered anything at all
Absolutely,
like that?
absolutely. Some of the things that we do encounter are male students who have gotten their girlfriend pregnant, or it could be a girl that they're not even really involved in, and they don't know what to do. They do know that they want to be involved in their child's life, but they don't know how to navigate that relationship issue and also be in their child's life. So we help them with that.
Beautiful.
We give them the services that they need. Other unique situations that we have with male students is we've had male students who are single fathers and have full custody of their children, and we also have had students who are couples and already had a child, and they were both in school, and we provide services to them as well.
I want to make sure we give some contact information, but if you can just give us, tell us one success story.
Okay, one success story is we had a student who was 21 years old. She is was a senior at Norfolk State. She had a 2-year-old daughter, and she lived with her mom. She and her mom had an argument, and her mom basically told her, you have to leave. You cannot live with me any longer. So, of course, she didn't know what to do. She came to us. We met with her, got her to calm down, and we just got on the phone, called our resources, connected with our resources to try to find her some temporary housing. Actually, we were able to help her see that she already had a resource. She was very, very involved in her church. Her church gave her refuge. While they allowed her and her daughter to live in the space that they had available, we were able to help her to get housing and get employment. And when she graduated in May, she graduated with a job. She graduated with permanent employment. So life is going to be great for her and for her 2-year-old daughter.
And you have a number of students that go through the program that do come back and and try and assist other students in those kinds of
Absolutely.
Yes.
Most of our students who have been successful, they want to share their experiences and help someone else as well.
So how can someone reach Project Hope at Norfolk State University?
Well, they can contact me directly. I can be reached at 757-355-5154, and I'm located on campus in the Student Services Building in Suite 312, which is inside of the Norfolk State University Counseling Center. I can also be reached at email. My email address is jjdove@nsu.edu, or they can email the Office of Pregnant and Parenting Student Services at oppss@nsu.edu.
Well, Ms. Dove, I want to thank you so very much for joining us today. Your program really, truly does give people hope. Thank you.
Thank you for having me. I appreciate it.
I invite you to stick around now. That does it for our first segment of today's Health Watch. We want you to stay tuned because coming up next is the EVMS Hopes Clinic. Today it's all about hope. Stick around with us. Welcome back to Health Watch. Our topic today is hope. In the first segment, we talked about the hope there is for Norfolk State University students who are pregnant or caring for a small child. Then we're going to talk about the hope there may be for some people struggling to get health care. We're going to take a look at the Eastern Virginia Medical School Hopes Clinic. HOPES is the acronym for the Health Outreach Partnership of EVMS students. Joining me now to talk about the HOPES program are Dr. Terry Babineau, Assistant Dean of the EVMS Office of Student Affairs, the Director of the School Service Learning Program, and an Associate Professor in the EVMS Department of Family and Community Medicine. Joining Dr. Babineau is HOPES medical student, Mr. Weston Lurd. Guys, welcome to Health Watch.
Thank you very much.
Tell us all about the HOPES Clinic. What is the HOPES Clinic?
HOPES Free Clinic is a different sort of free clinic. It's a student-administered free clinic. It's the only one in the state of Virginia. We are part of the Society of Student-Run Free Clinics in America. But a student-run free clinic is different because our students do all of the administrative part. They make the appointments, they develop the protocols, they staff the clinic. All of the patients are seen with the students with attending physicians, and it's all done under the auspices of a medical director. But the efforts and the behind-the-scenes running of the clinic is completely done by our medical students.
I'm sorry, did you say that it was unique in the state or it's unique in the state, not necessarily unique in the country? But
no, there are many other student-run free clinics in the country. We're the only one in the state of Virginia.
What is the concept behind that? What is it that you hope that students get from doing everything, all manner of operations?
There's a number of things. One of the biggest things that we hope is that the students actually get to see real patients early in their medical career. It's a very important thing, and it's something that EVMS is known for. We have very early clinical contact for our students, because we feel like we don't want them to just learn medicine in the book. We really want them to be able to see and interact with real people who happen to be patients. That's one thing. Another thing is we really want to teach advocacy. Weston's an incredible example of a patient advocate, and we want our students in all of our programs. This is not just for our MD students. Our Masters of Physician Assistant students are in this program, our Masters of Public Health, our Masters of Art Therapy, some of our surgical assistants are in this program. So we want our students to learn how to work as a team and how to learn how to problem solve. And it's a wonderful venue for us to be able to accomplish that.
And it is no surprise that a medical school founded by the community, essentially, would do something as innovative like this. How would you define the typical HOPES patient?
The typical HOPES patient is someone, by definition, they live within the city of Norfolk. They, because there are free clinics in all the other areas around of Hampton Roads. They live within the city of Norfolk. They are uninsured. They have no medical insurance. And they tend to be 200% of the poverty level or less. The thing that's amazing about it, though, is that when you put that definition on it, you would think people often think that this is just for homeless folks. It isn't. Almost all of our patients are working. Many are working more than one job, but they have no benefits. Many of them have actually kept the same employment that they had for years and years, but because of outsourcing or other kinds of issues, they end up losing their health insurance, and so they just have no insurance. But because we're an appointment-only clinic, it's not a walk-in facility.
Understood.
We are their medical home.
Well, you mentioned that the Hopes Clinic is, of course, unique in the state of Virginia, but what are some of the unique features of the Hopes Clinic? Beyond, is there anything else you can elaborate upon beyond the fact that it's student-run?
Well, it actually, in part, it is because it's student-run that makes it unique. Because our students are so innovative. They are such incredible problem solvers. They are very committed to the patients. So the patients feel a great connection to our students. There's so much energy there. We've even had patients who have gotten insurance and been upset about that because they could no longer come to Hopes.
Wow, that's pretty good.
Because the follow-up is so intense. Our students actually, and certainly Wes can tell us about that, but our students really connect with the patients and take them on as being associated with them and kind of take ownership of helping those patients navigate the system.
Wes, what has been your experience? Might I call you Wes? Or you?
Sure.
Okay. What has been your experience with the Hopes Clinic?
Well, most of the work I've done with the clinic has been as a continuity coordinator.
Continuity of care?
Continuity of care, exactly. It's our effort to keep that continuity of care going, because when a student sees a patient as a clinician, it's going to be a different student every single time because we have so many students volunteering. But the continuity coordinators are about 12 students, and when the patient calls, they're the ones that answer the phones. They see the patients at the end of their appointment. They schedule appointments. If a patient needs a resource separate from the Hopes Clinic, then we have an extensive list of resources that we can help them with. So it's one of the most rewarding jobs that you can do at Hopes, because you are able to follow the patient through any issue that they might have, and you're really able to kind of create a connection with the patients.
Has there been anything that surprised you about this experience?
Coming into it, I was surprised at just how much students could do. It's grown
in terms of management and operation.
Management, yeah. I mean, we're kind of running a small practice, really, and it started off as a couple patients a night, and now we're having 20 to 30 patients a night, depending on which clinics that we're running. And it's really been an experience to see just how much we can do, how much we can do for our patients.
That kind of makes for a next a segue right into the next question. How have you benefited from this experience, particularly in pursuit of your career as a physician?
As Dr. Babineau was saying, it gives medical students an opportunity to work with patients very early. I was seeing patients at the Hopes Clinic my first semester, which from my understanding is unique for a medical student. So I've been working with patients at Hopes for 2 years now, and so as I go into my third year where I'm going to be in the hospital every day, I feel like I am very prepared for that. And on top of that, it's also shown me I have a lot to learn, because you're learning all this stuff in the books, and it showed me, working with patients has shown me that that's not all you need. There's a lot more to it.
It certainly would seem to reinforce the Hippocratic oath, the whole idea behind that. Now, you kind of, I think you alluded to some of this earlier in terms of Norfolk residency, 200% of the poverty level. What other kind of eligibility requirements are there?
We see patients ages 18 to 64, And the reason that we have those age brackets are because up until 18 in the state of Virginia, children can get FAMIS, which is Medicaid type insurance. And after 64, at 65, our patients graduate on to get Medicare, and so they are insured. So we are truly trying to see those folks who really have no insurance. So that's also some of the eligibility as far as age goes.
What do you think is the most distinctive thing between a place like the Hopes Clinic and a typical private practice? Either one of you can respond to that.
I think there's a number of things. Of course, there are some incredible advantages to having insurance and being able to have a full range of medical care. So on the, I guess you would say, the negative side, it's difficult because our services have to be fairly limited. We use medications that are generic medications only because our patients have a great deal of difficulty paying for medication. And sometimes that provides great barriers. Our ability to do testing, laboratory testing and radiologic testing is very limited, and that's also a huge barrier. And the other thing that we have a great barrier is subspecialty care. So if our patients need to see a cardiologist, until we have developed some subspecialty clinics within Hopes, we've had a great deal of difficulty with that. Now we do have within Hopes the Women's Health Clinic, where we do prenatal care, pap smears, excuse me, sexually transmitted disease screenings. We have endocrinology, we have dermatology, we have art therapy clinics. So we're broadening our subspecialty care, but that is one of our limitations until we get more and more subspecialty clinics within Hopes.
How many students do you think, with the administrative and appointments and so forth, in addition, of course, to the clinical care, how many medical students are involved?
We have about 50 to 60 students who have a specific position with the clinic, but we also have volunteers come in. So we've had over 300 students.
And the volunteers that come in are students as well?
Right.
Yes.
Fantastic.
In our first year MD class, for instance, 97% of our students have signed up. EVMS really is, our strategic plan is to become the most community-oriented medical school in the country, and we are playing that out definitively, and our students many of them come to our school just because we are so community-oriented, and you can see that in those kind of numbers.
That's absolutely fantastic. Westside stated that the Hopes Clinic is actually down in the building I work in at 830 Southampton Avenue at the intersection of Bremerton and Colley. But what are the hours that the Hopes Clinic is open?
Wednesdays and Thursdays, 6 p.m. to 9 p.m.
And you stated that it was necessary to make an appointment to be seen. How does one do that?
Well, some of our clinics are at capacity, so we're unable to take new patients for some of our clinics. But if someone wants to call us at 757-446-0333, if they have an issue that we can help them with, we can schedule an appointment for them. If we can't, we have an extensive list of resources in the community that we can point them towards.
Dr. Babineau, can you tell us a little bit more about the services? Is there anything else you can tell us about the type of services? You mentioned the different subspecialty clinics. What other kind of services are provided?
We're starting to do more and more screening type work. We're working with the Strelitz Diabetes Center, where we're doing some diabetes screening that we're operating through Hopes. We're also looking at expanding our dermatology clinic is just absolutely phenomenal, and some of the resources that they are bringing as far as screenings and that kind of thing have also really started to grow quite a bit. We also have just gotten an orthopedics clinic that we're running, and we're hopeful that we're going to start working with other schools and universities around our region to see if we can advance even some of the other healthcare entities, so that we really do develop a team-based learning and experiences for our patients.
Earlier, your eyes lit up when you talked about the Women's Health Clinic.
Yes.
And you mentioned some of the services there. Can you elaborate, if not on the services, why you're so enthusiastic about the Women's Health Clinic?
The Women's Health Clinic was one example, I think, that our students really showed how incredible they are. They found out, a small group of students found out that women in Virginia were not getting their Medicaid services for their prenatal care until their second or third trimester, which a lot of times was a little too late to really be bringing to bear great health for both the baby and the mother. So they figured out that what a woman needed was to have the diagnosis of a pregnancy. They needed a physician to actually be able to say that they were indeed pregnant before they would get Medicaid. It's a very simple thing to do, but most women who don't have insurance can't go into an emergency room or pay to go to a clinic to get the diagnosis and then be able to apply and get Medicaid insurance if they were uninsured. So they developed, our students developed this clinic working with our OBGYN department as well as me as the medical director, and now we have a women's health clinic where the women come in who are newly pregnant. There's no charge. They are diagnosed as being pregnant. The prenatal care starts right then. We then refer them on to resources within our region, and there is also a network to support them with resource mothers, and some of our students are becoming advocates for them so that they can get that needed insurance, and then hopefully it'll improve the health of our region, much less the individual mothers and babies.
Fantastic. Very quickly, if you can give us, Wes gave us the number earlier for someone to call for appointments. How can someone reach your office in general with any inquiries?
That's actually the same way, is through that 446-0333 number.
Right.
As well, you can email us at hopes@evms.edu. And that's the way to get in contact. We're always looking for new physician volunteers as well, so to be attending physicians.
Absolutely fantastic. And Wes, I wish you the absolute very best.
Thank you.
Guys, I want to thank you so very much for joining us for Health Watch today. This edition has been all about hope, and with yourself and the other guests, I think we've accomplished quite a bit. Thank you so very much.
Thank you.
I want to thank you for joining us for this edition of Health Watch. You can check out previous edition of Health Watch at www.norfolk.gov. Go to the Norfolk TV tab, and you can see all of the shows that are produced by the Norfolk Department, by the City of Norfolk Office of Communications. If you want to send me an email, you can reach me at terrence.alfred-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Alfred Anderson, and this has been Health Watch.